Well, hi, everybody. Today, we're going to be talking about mental disorders. And one of the things we want to think about with mental disorders is how they affect a person's feelings, thoughts, and behaviors. Here you can see several of the most common attributes to mental disorders, and that's just a smattering, a small number of all the things that might be going on with people you know and potentially even ourselves. Mental disorders may have a physical cause, such as a disease, an injury, or drug use. Sometimes heredity is a factor in whether a person experiences an emotional disorder. Other causes can be related to stress, usually developing after repeated emotional stressors or very traumatic stress. It's recommended that mental disorders be identified and treated early so that there aren't problems throughout a person's life. Here you see a list of several mental disorders, but you notice the three dots at the bottom. This is certainly not an all-inclusive list. There are many, many disorders that occur, and many of them can be helped, if not completely treatable. Disorders related to anxiety include panic disorders, phobias, obsessive compulsive disorder, and post-traumatic stress disorder. Anxiety is the root for several mental disorders. Getting a handle on anxiety through getting help is one way to cut off some of the potential negative effects of that anxiety. Treatment of emotional disorders depends on the cause, the behavior of the person who's experiencing the disorder, and the available resources in his or her community. Therapy might include talking to a mental health professional, might include medication. It may include something called behavioral therapy, or becoming aware of the triggers for, say, anxiety, recognizing them, naming them, and then choosing your behavior afterward. It may require hospitalization. For instance, someone may need to be reset on their medications. They may just need time inside a hospital to get their medication situation right or to take them out of a crisis situation. Therapy could be individual or it could be in a group setting or a support group. Usually, getting help sooner rather than later is recommended. Sometimes the treatment is initiated by the person with the disorder asking for help because that person recognizes that something's not right and they need help. Other times, someone else might do a referral, suggesting the family access assistance from a mental health care provider so that they can help the person involved. That person, the mental health provider, will probably do an assessment to identify the exact problem and recommend the best solution moving forward. Mental health disorders can greatly compromise a young person's life. Getting help is appropriate and necessary to get well and to live life to the fullest. Self-destructive behaviors and thoughts are an indication that a young person is deeply sad, feels he or she is not supported by others, or feels disconnected from family, friends, or school. This can happen for any number of reasons. The behaviors that this person may go through, may exhibit, could be reckless and involve risk-taking activities. Those behaviors may include taking risks for injury, such as placing oneself in a dangerous situation or failing to protect oneself in a dangerous situation. People may engage in self injuring things like, for instance, cutting, taking dares, moodiness, and withdrawing from family and friends. If a student notices these changes in him or herself, help should be sought out. Friends can give support and extended kindness and understanding, but in these situations, an adult, and a qualified adult, is certainly needed to intervene. Adults who are considered trustworthy and credible include parents, guardians, grandparents, teachers, coaches, nurses and doctors, guidance counselors, youth leaders. You learn quickly who you can go to for help, but you have to know this. Some adults are not really good to go to. If what you take to them is not taken seriously and not taken up immediately, you gotta find another adult who can help. It should be noted that adults also are not allowed to keep self-destructive intent a secret. So, if someone comes to you or to an adult saying that they're having thoughts of suicide, that has to be reported. So, that's not something that can be kept to oneself or kept in secret. The more clearly and directly a student expresses the need for help, the better. Someone should seek help from a trusted adult. If that person doesn't believe or trivializes those feelings again, please make sure that you continue going on and on to other people until you get someone who's willing to help. The real difficulty here is when someone's in crisis, oftentimes they have to be their own advocate because others may not know what's going on. So it's important we think ahead. Identify people we can go to that we trust in any type of crisis. And then when we feel like a crisis is occurring, we go to them immediately without hesitation, vent, let them know what's going on, and let them help. Thanks so much for listening.